Today we're going to talk about the diagnosis of hypertension, and there's four main points that I want to talk to you about today. The first is that NICE introduced their new guidelines in August 2011 and recommended that diagnosis should be made if the blood pressure is over 140/90. Now, in the clinic, if a measurement is taken and this is equal to or over 140/90, then a second measurement should be taken. And that if this is different, then a third measurement should be taken, and the lowest of these three measurements be used. Now, if this third measurement is above 140/90, then NICE advise that you should proceed to ambulatory blood pressure monitoring, which is normally done over a 24-hour period. And from the ambulatory readings, the mean value should be used. Now that's important, it's not the average, it's the mean. Now many surgeries may not either have an ambulatory blood pressure monitoring machine or access to such a machine. Therefore, a study in the BMJ in 2009 did provide evidence for the usefulness of a home blood pressure monitoring machine instead. Now, a systematic review reported in the BMJ in 2011 compared home and clinic measurements versus ambulatory blood pressure measurements. And what it found was that both home and clinic measurements had a lower sensitivity and specificity. The important point to take home from this is the lower specificity, which gives rise to more false positives, which in turn leads to overdiagnosis and therefore overtreatment. Their conclusion was that clinic and home blood pressure monitoring were useful as an initial screening tool, and that if the results were positive, i.e. were over this 140/90 mark, then ambulatory blood pressure monitoring should be used to confirm the presence of hypertension. Now at this point it's useful to discuss what's known as the correction factor, and that is, what are the equivalent readings that you would find in clinic to the ambulatory or home blood pressure readings? Now for stage 1 hypertension, the clinic reading would be equal to or greater than 140/90, and this has an equivalent level in the ambulatory and home readings of equal to or greater than 135/85. And for stage 2 hypertension, where the diagnosis would be made with readings equal to or greater than 160/100. This corresponds to equivalent readings from the ambulatory and home measurement machines of equal to or greater than 150/95. So those two levels are important to remember when looking at the home measurements and the ambulatory measurements. Now the last point I wanted to discuss was an important trial called the Cambo trial, which was reported in the BMJ in 2011. And what they did was they randomized patients into one of two groups. The first being those having their blood pressure taken with a manual machine versus those having their blood pressure taken with an automated office blood pressure machine. Now you may have seen these machines. They're often found in general practice waiting rooms. The patient puts their arm in the machine, it automatically takes the blood pressure and produces a nice little printout that they often come into the clinic with. And what they found was that the automated machine readings closely approximated those to the ambulatory blood pressure readings, and that the manual readings, again similar to the previous systematic review, had a lower specificity and an increased number of false positives, which led to overdiagnosis and overtreatment. And they came to the conclusion, which supported the use of automated blood pressure machines over that of taking the blood pressure manually. So the overall take-home message of this is that the use of ambulatory blood pressure monitoring machines has been introduced into the diagnosis of hypertension, and that if you don't have access to such a machine, then the use of home blood pressure monitoring is also useful. However, the use of home blood pressure monitoring machines and clinic readings are still deemed important when monitoring and titrating treatment. Thank you for listening to Medical Hot Topics on the diagnosis of hypertension.